what gestational diabetes actually means?
Pregnancy is usually a stressful thing in a life of a female. Stressful in sense of physical stress. Demand is required because nutritions are supplied to the baby, glucose is supplied. So risk of hypoglycemia. To reduce that risk, body tries to produce too much of sugar, suppress insulin. That is the normal condition. But if that baseline is increased after second trimester of the pregnancy, second and third trimester, it is called as gestational. If it is in first trimester, then we can say it as pre-gestational diabetes, and if it is before first trimester, then it's just diabetes.
Okay.
So nowadays the rise in number of gestational diabetes is seen.
Does it go away once you give birth?
Yeah, it goes away once the mother gives birth to the child, but the risk of developing diabetes in such patients is very high. So at least according to books or protocols, every 3 years a female should screen herself for diabetes. But I will recommend annually is always better.
Whether you had gestational or not, or only if you've been...
No, if the female had gestational diabetes, then.
Okay, then screen yourself every 3 years.
Yeah, every 3 years.
Okay.
And if she is healthy enough, then no need to, if she had no gestational diabetes, then no need to screen as such.